Hello, today I want to demonstrate for you the proper PPE for COVID-19. You'll notice that I already have my lab coat on, and my lab coat has cuffs, it's buttoned up to the top, and is at least knee length. So you can choose to use this kind of lab coat, or you could choose to use a disposable lab coat. You'll also notice that I already have my booties on, my shoes. Or you could use hypochlorous acid on your shoes and spray that. So right now I'm going to demonstrate proper hand sanitization according to the World Health Organization. So we're going to do hand to hand, and then hand over hand, and then we're going to start getting in between the fingers. Thumbs, and then little circles, and then now your hands are sanitized so we can begin to put on proper PPE. One very important step that my team and I do before we start or put on any other PPE is we gargle. And you make sure that you're gargling all the way in the back of your throat so that you can get all the virus and other bacteria that is in the back of your throat as well. And that's how it's done. So for the demonstration purposes, I've gone ahead and I've added the disposable lab coat. What I want to make sure that you know is that the lab coat needs to have cuffs, it needs to be below the knees, and it needs to be properly tied to start the procedure. Now we're going to go ahead and put on our mask. So if all you have is a surgical mask, you could wear a surgical mask. For today, I'm actually going to demonstrate an N95. You could also use a KN95. So the first thing I'm going to do is put the rubber bands back on and then put one above my head, one below my neck. Make sure that you pull down here so it's properly over it and that this is pinched down over your nose. This is the next piece of protection. It's a head and beard cover. It's going to cover your head and you're going to put it on like this. The other benefit of this is you see it covers your mask so that you're able to use your mask longer. So now I'm going to go ahead and put my loops and my light on and tighten them. Now I'm ready for my shield. So here's how you put on the shield. It's pretty simple. It's just going to go over your head like this. Can I have you wait there? I'm going to give you a mask. Can you put that on, please? And go ahead and pinch it here, pull it down there. I'm going to take your temperature. Okay, great. Have you had any coughing or any concerns? Nope. Not been traveling? No, feeling good? Yep. Yes? Okay, you can come on in. I'm going to go ahead and have you do this. Can I have your hands? And then you're just going to follow this. Okay, very good. Good job. Okay, you can come with me. Julian, if you can go ahead and come inside. Okay. Have a seat. Go ahead and get comfortable. Are you comfortable?
Yes, thank you.
Excellent. So I'm going to go ahead and take my gloves off and change them and wash my hands.
Okay.
Okay? So where we are now, our patient is comfortably seated, and in front of the patient, I'm announced that I am going to be washing my hands. I'm going to remove the gloves that I had when I greeted him in front of him so that he knows that I'm disposing of these. And then I'm going to use soap and water to clean my hands. I'm following the World Health Organization's chart as you can see here, posted so that the patient also knows. This is a perfect opportunity to educate them as well as to how they should be properly washing their hands. So doing this demonstration in front of them is quite helpful. So it's palm to palm. And then we're going to interlace our hands. Then we're going to do fingers interdigitated. And then knuckles, thumbs, thumbs, circles, circles, and we're going to start rinsing. Perfect. Now we're going to go ahead and dry thoroughly. Wiping the area down, and now we're ready to go ahead and put on our gloves. So we're going to go ahead and put a bib on. We're getting ready to do a pre-rinse for you. You can go ahead and take off your mask.
Okay.
This pre-rinse is going to support you and us from having the spread of viruses into the air. Okay? So I'm going to ask you to go ahead and gargle with this and swish around in your mouth. Make sure you get all the way back to the back of your throat. Okay? And you can spit right back into the cup. Perfect. Thank you very much. So to repeat where we are now, the patient is comfortably seated. He's already done his pre-rinse. I've already changed my gloves and washed my hands in front of the patient. Okay? The other thing that we're going to do is it's very important that we are keeping our instruments in the bag, and we're letting the patient know before we start that we're going to go ahead and open the bags in front of them. This is an important measure for the patient because now they're reassured that safety is the most important thing to us. So we're going to get ready for me to do the last step, which is to put on my face shield to get ready for the procedure. I'm going to need to position the light so that I can see it perfectly. After that, I'm going to go ahead and put the shield on, and it will stay on during the procedure. And now I'm ready to start. I'm going to bring the patient back. We're going to go ahead and open up all the instruments that we've sterilized for our procedure today, and we're ready to get started. Okay? Julian, I do have a special device here. This is going to help to catch all the aerosol as we're working on you. It's going to go in your mouth. It actually works pretty comfortably, okay? Another very important part of our protocols is to use an intraoral evacuation system. This one happens to be Dry Shield. Other examples are Isolite, and there are many more. We're going to go ahead and get started. So I'm going to be putting this in. Perfect. You're doing great. Are you comfortable? You okay? Okay, very good. I'm going to go ahead and turn the suction on, and we're ready to start. Okay, so now we've finished our procedure, Julian. I'm going to go ahead and take this out, okay? Go ahead and open real wide. Perfect. You did fabulous.
Thank you.
We're going to go ahead and sit you up.
Okay.
And let me ask you, did you feel, how does that feel?
Fine.
Good.
Good.
Any questions for me?
Nope.
Okay. Julian, come on with me out here. I've already instructed Julian to be wearing his mask on the way out, and now we're going to do the last hand sanitizing. With the World Health Organization's poster, he's going to follow the instructions. Great. Thank you for coming in today. Goodbye.